Well, folks, as usual, I want to spend time on this healthcare issue, and who better to bring on than Betsy McCaughey, Ph.D., chairman and founder of the Committee to Reduce Infection Deaths and former Lieutenant Governor of New York. How are you, Betsy?
I'm glad to be with you today because so many people are being blindsided by this healthcare legislation, largely because what they've heard about it is untrue.
Well, Betsy, hammer away. Go.
Well, first of all, the president promises that if you like your health plan, you can keep it. And that, I hate to say it, is a lie. If you have a Blue Cross Blue Shield plan, the kind that lets you go to the doctor when you want to, see a specialist if you think that's better, get a diagnostic test, you are not going to be able to keep it. If you look at the House bill, all 1,018 pages of it, you only have to get to page 15 to understand that you are going to be forced to give up that plan for a managed care style plan that will limit your access to specialists and tests.
And yet he says it even today. I mean, he gets away, I don't want to say gets away with it. People like you are pounding this, but a flat-out lie. So you are making clear to the folks out there that you will not have your private health care, your private policy in the years to come.
It will technically be private, but here's what's going to happen. Both of these bills, the House bill and the Senate bill, which will be merged at some point later this month, they create a new government bureaucracy that will call for a basic health plan. They call it a qualified plan. And no matter how many companies offer it, the benefits are going to be the same. And it will be an HMO-style plan. And if you currently get your plan through work, you're going to have to switch. Your employer has a grace period to switch you out of your current insurance into one of these government-qualified insurance plans. If you currently buy your own insurance, you're not going to have that grace period. As soon as anything changes in your current insurance contract, like the insurer changes your copay or your deductible, those generally change every year, you're going to be legally required to give up that insurance and move into this government-qualified plan.
Now, my guess is the government-qualified plan will have all these bells and whistles.
It has to be an HMO.
It'll be an HMO,
yes.
And it'll have all these bells and whistles that'll drive the private sector into bankruptcy. And then, when they have everybody enslaved in this government-run system, then the rationing will start, right?
Mark, let's make it clear. I'm a patient advocate. You can talk about what it's going to cost. I'm worried about your health. And in these managed care plans, you're not going to be able to make the choices you currently make to see a specialist when you need to. You're going to have to wait longer for care. And let me make it clear that whether you pay for this plan yourself, or whether your employer pays for it in full, or whether you get a government subsidy, you're all going to be in the same plan. And you're going to have to put up with those HMO limits. The idea here is not just to insure the uninsured. I share that goal. The goal is to also reduce everyone's health care consumption, right? So the government's going to be limiting how much care you get. And the other goal is to ensure that people have the same health care experience regardless of ability to pay. They don't want people spending their own money to get more health care than what the government can provide to somebody else.
I mean, basically, even if you want a better policy, you're saying you can't get it.
No, everybody's going to have to enroll in the same basic style plan. The benefits are going to be the same whether you're paying for it yourself or whether the government is subsidizing it. And if you don't sign up for it, and then you go to file your taxes and you can't prove you're in one of these qualified plans, you're going to be fined thousands of dollars, thousands, as much as the average cost of a health plan in the United States for your family size, and then you're going to be automatically enrolled in a randomly selected plan.
Well, what if the government HMO type plan and this randomly selected plan don't cover what you need to have covered?
Well, that's going to be too bad. And this is kind of a blank check because all of the decisions about what will be covered and what the plans will cost, that's going to be decided by this government bureaucracy after the bill is passed and after you're locked into the system. Now, it's going to be even worse for seniors, by the way.
I've been saying this is a war on senior citizens. Will you explain that?
Well, it really is. Just to go to the numbers for a second, these bills cost somewhere between $1 trillion and $1.6 trillion. Those are the CBO estimates. Half of the cost of this bill is paid through tax increases. The other half, believe it or not, is paid by reductions in Medicare benefits. Over $500 billion, that's more than a 10% reduction in Medicare. Now, remember, Mark, more and more people are suddenly moving into Medicare because the baby boomer generation is reaching that age. So many more people are going to have to be cared for, but they're taking $500 billion, more than 10%, out of the system. So it's going to mean treatments are going to be in short supply, longer waits, fewer nurses on the floor. They've got to make everything stretch really thin.
Well, is this why Obama today asked Congress for the power to cut Medicare costs more? He asked today he wants more power to cut those costs.
Yes,
and by the way, that doesn't mean that doesn't mean efficiencies and streamlining.
Oh, no.
That means right in the throat.
Right in the throat, because the Congressional Budget Office has already looked at these bills and said less than 1% of these cuts will result in reductions in fraud, waste, and abuse. Obviously, the rest then will go to reductions in patient care. And the mastermind behind this, the guiding person behind this, is Ezekiel Emanuel, the brother of the President's Chief of Staff, Rahm Emanuel.
Remind us of, again, you have exposed this. Remind us of what this man has written and said in the past.
This man is a highly educated doctor, very widely published, but his views are so dangerous. And he says, for example, that people who have an incurable illness should not be guaranteed basic health services. And I'm going to read you a quote, Mark, from one of his articles. An obvious example, this is his quote, an obvious example is not guaranteeing health services to patients with dementia. That's a direct quote. So you tell me that my mother, if she develops Alzheimer's, is no longer eligible for health care? Or a child with cerebral palsy can't get basic health care?
This is Rahm Emanuel's brother, right?
And this is in writing. He also says that basically health care should not go to the elderly. He says age discrimination is not evil like sex discrimination or race discrimination. Age discrimination, he says, makes sense because everyone who was 65 was once 25. So he is against allocating health care resources to the elderly. And he says that when your doctor is treating you, your doctor should not focus so much on your needs. Your doctor should not take the Hippocratic Oath seriously. He says your doctor should be thinking, is this patient worth it? Or would the money be better spent on the younger patient down the hall who needs prenatal care? Or maybe on education or the arts? That's what the man says.
I know you have to go. I want to thank you for your time. These 7 or 8 minutes have been absolutely crucial, Betsy, and I want to be able to call you back, okay? All right. That's Betsy McCaughey, who is absolutely terrific on this, and we will bring her back. She had to go. We'll be right back.